I think, taking place sometime today or tonight. So I'm going to go ahead and start with roll. If you will just let me know that you're here, that would be great. I'll start with Dawn.
I'm here.
Good morning, Dawn. Yolanda. Kevin.
I am definitely here.
Excellent. Sam. Carlos. Miss Ashley Chase. Jill Cohen.
Good morning.
Good morning, Jill. Michelle.
Here.
Jessica.
Morning.
Morning, Tara. Ida.
Good morning.
Hello, Jennifer. Leanna.
Good morning.
Hi, Zane.
Like 58% here. The
Get
rest
more
needs to be marked
coffee.
absent.
Get more coffee. Increase your energy, right? Nate. Adriana.
Hi, good morning.
Good morning. Lori. Gina Lopez. Not seeing Gina. Shauna.
I'm here.
Gina is here. Yes. Okay. Shauna. Chris. Chris Menz.
I'm here. Sorry.
Michelle. Great. Thank you, Chris. Michelle Murphy. Margaret. Hello, Margaret.
I am here.
Sarah.
Here.
Rashan.
Here.
She's here. Great. Casey. Kathy Wells. I'm not sure what that was, but I don't think it was Kathy Wells. Okay. Donna Wilson. Kelsey. Jade. Aletha.
To live.
Sorry, good morning. I'm here.
Present.
And Aletha's here. Good. Okay, that is my roll call. Thank you all. Moving on to your meeting materials, I am going to go ahead and ask about the meeting minutes and the meeting recap for February 28th of 2024. Are there any additions or corrections to the meeting minutes from that date?
I have a correction to the recap. Sorry, is this minutes?
We're doing minutes right now, but hold your
I'll come
thought.
back.
Thanks, Margaret. Anything on the meeting minutes? All right, seeing none, if I could have a motion to approve and a second, and please announce your name as you do so.
This is Margaret. I move to approve the minutes.
Thanks.
This is
Adriana,
Adriana.
I'll
I'll do a
second.
Okay, we'll take Adriana on the second. And are there any objections to approval of those meeting minutes? Okay, not seeing any. Great. We'll move to the meeting recap of February 28th, 2024. And Margaret, if you could share with us your corrections on that one.
Yeah, it looked good. I think that the top with respect to I think it was the objective. I don't have it in front of me because I only have one screen today. Related to the Montoya task force, there was just an error in copying and pasting it over to our task force.
Okay, let us, that would be an important one. Yes, it has the Timothy Montoya Task Force. Thank you. Any other corrections to that meeting recap? Okay, if I could have a motion to and a second to approve those, please.
I'll move to approve as edited.
Great, thanks, Margaret. Do we have a second?
This is Michelle Dossie. I'll second.
Thank you, Michelle. Are there any objections then to the approval of the meeting recap from February 28th of 2024? Okay, those documents will all be approved. Thank you all.
All right, I'm jumping in. Is that me?
That's you.
Okay, perfect. All right, well, good morning, everyone. Thanks for being here. We've got a 2-hour meeting today, so lots to do, lots to pack in. And if you need to step away for a break, of course, we totally understand, but we will not be. We will just be driving straight through. So with that, I'm going to share some slides real quick. I want to talk about kind of, again, reminding us of our roadmap, where we've been, where we're headed. Talk a little bit about today and how we got to where we are, and then we'll dive in. So again, you should have received additional calendar invites from Addie for each of these dates. Some of these you already had, and then some of them were additional. So if you do not have these on your calendar, please just send Addie Fisher a note in the chat, and she will make sure to get you added. With that said, today, March 13th, we're wrapping up our conversation. No, we're wrapping up our feedback portion of the conversation around alternative processes and services. So again, we're going to bring up y'all have had multiple opportunities to kind of provide the input. We've obviously heard a lot from, other examples, other states. We also had the research piece that everyone was able to read through. So we're going to really dig into that today and start to build out some recommendations from you all. And we'll talk about kind of how we got to the determination that that's what we were ready for. March 20th, well then you'll have an opportunity to see, between now and March 20th, you'll have an opportunity to see draft recommendations and respond to those as well. And then we'll do a vote and move things on. And then from there, we've got the remaining 16 directives to get through. So this is just a repeat of the last time, but we'll be going into 2 subcommittees. So the phase 1 will be a training subcommittee, and there will be a reporting processes subcommittee. And this is how we're breaking out each of the directives into those. I think the goal would be that we can have folks self-select, but also the idea is that we might have to move folks around as needed if we don't have enough in each group. And then phase 2 would be these 2: specialized occupation subcommittee and data subcommittee. Any questions about the additional dates or how we're moving through things moving forward before I move us on to today? Or anything Stephanie or anybody y'all want to clarify as well? Okay. All right. Moving on. So reminder of kind of what you've received so far. And would encourage you for today to bring up the email that I had sent last week with the materials, if you'd like to reference any of those pieces as far as the research materials that the CPO office put together. But as a reminder, the resource summary was really around, so the 3 recommendations we're moving into are the decision tools, consultations, and warm lines. And each of the subsequent pieces here were the things that were shared out to you in that resource. In addition to some of those obviously came and presented. So these are really the examples we're pulling from. That's not to say that you can't be pulling from other ideas and other experiences, but just wanted to make sure that we have a reminder of the resources that we're specifically pulling from as it relates to this group. And with that, I want to just share out kind of how we got to that we are moving forward with the recommendations around these particular 3. So starting with the decision tool. So we asked this question. These are the survey we gave, and we received majority support for yes. So 24 responses, and then within those 24, we received majority. So and that is majority of the task force. So we are moving forward with a recommendation around decision tools. So today we get to talk about what is that recommendation going to be and what are those specific elements. So 87% of you were in support of that, and a few of you were unsure. There was no obviously on here. So I think as we get into the discussion, it'll be helpful to just kind of hear from folks around the unsure piece. Hopefully today we can get to some language that you all feel comfortable with. as far as the examples go that folks felt momentum around. So the biggest one here, as you'll see, and this is again just with the decision tool, was really this Evident Changes Community Resource Guide. So those are the folks that we had come speak to us, and it just seemed like there was a lot of momentum. And also in the responses, people were kind of excited. You know, there were some questions around, is Colorado ready for this? Or is this just the direction we should be moving towards? And I think that's the kind of questions we're going to be wrestling with today of, you know, what currently exists and what do we feel like we can strongly move towards in a recommendation? And also like, what's the recommendation to make sure that Colorado gets where it needs to go if this is the kind of program that you all would like to see. And somebody just jump in and stop me if you have any questions around these. Moving on to the second question. Oh, sorry. Did I skip a slide? I think I did skip a slide. All right, here we go. So creating the Wormline system, again, with the 24 responses, nearly 80% of you said yes. There was one person that said no, and I believe it was 3 people that said unsure. So with majority, we're going to move forward with a recommendation around a Wormline system. And as far as the examples go, this one was a little bit more shared across a few. So the green, I'll just say is there wasn't an example. So I think there's a lot of work to do here around, maybe it's not perfectly baked in any of the examples you heard from, but there is a little bit of this, a little bit of that, a little bit of your ideas. But there was a strong consensus around the Here's line with New York. And then there was also the Connecticut's Care line that rose to the top. So we'll definitely be interested to hear from the 16+% and anyone else around the like, yes, Wormline, and not quite sure what that's going to look like. So what questions you have there. And then moving on from that. Sure, slide's not moving. I think I just.
That was
Somebody
good.
help me here? Did I jump forward?
Yeah, this should be the next one to go through.
Okay, perfect. And then this is the consultations piece. So I think my slides were just jumping. So the consultations piece, again, with the majority, 70% saying that they do support this as a recommendation. So we will be moving forward with a recommendation from this group around consultations. We have a decent percentage of folks unsure again. So that's what today is for, to flesh some of those questions out. And then a few folks on no too. So my question would be here is, perfectly fine to feel like you don't support this, and would love to hear, like, is there anything that you would feel good about as this group moves forward with a recommendation? And as far as examples go, the Arapahoe County, so Michelle, I think you moved the people because we had a pretty strong consensus around that is a something worth replication or expansion in Colorado. So we'll be curious to hear more from folks there. So with that, I'm gonna stop sharing my screen. And so what we're gonna do today is we're gonna break it down into kind of 3 separate conversations around each of these. We've got about 30 minutes for each group. Obviously, it might not take that much, but we've got some key questions we're gonna be working through, and we're just gonna replicate that for all 3 examples and all 3 recommendations. And really, just want to encourage folks to jump in. We're here to kind of wrestle with some of these key questions and key elements, because we've got to dial this down into a meaningful policy recommendation. We're kind of out of the window of, do we like it? Do we not like it? It's like, okay, we're moving forward to the recommendation, and like, what are the key elements here? So just want to push us in that direction to really jump in and make sure that you're present today with that, and we'll get through all 3. So with that, I'm going to hand it over to Doris, who's going to start us around the decision tool piece.
Awesome. Thank you, Trace. Good morning, everyone. So just to recalibrate us, center us on the decision support tools. They're designed to aid mandatory reporters in figuring out what might be the right intervention for a particular kid or family need, and determining whether or not a circumstance is ripe for reporting to the mandatory reporting line or the hotline. So want to unpack the survey results with all of you. We had a critical mass of task force members who completed the survey. There was, as Trace just illustrated, overwhelming agreement that Colorado should move in the direction of adopting some sort of decision support tool. And a majority of you like the evident change approach. And so wanted to unpack with all of you what are the must-haves in the decision support tool, so that as Jordan and Brian behind the scenes start to craft a recommendation for all of you to react to, we can articulate each of those elements. So I want to open up the floor and just hear from all of you. What were the things that you really liked in some of the tools that you saw, or what are the things that you would consider must-haves in Colorado's implementation of some kind of decision support tool for mandatory reporters? Chris, and then Michelle. Michelle D.
I really like Connecticut's system. When we did the whole demonstration aspect of it, it made a lot more sense from her talking to showing, because I'm very visual. I like the fact that, you know, there's autonomy in getting through to and helping you make the decisions, the clarification of the laws. You know, you're not on hold. As much as automation is a pain in my behind at times, I felt like it was very self-explanatory and very easy to use and manipulate, regardless if you're a mandatory reporter or you're just trying to get information to see if you should say something. So I really like the way that it critiqued and how we can apply our law to every piece of it, from the emotional, or maybe, you know, the questions that we were having as we were describing abuse, we could put these into the tab lines, and then it self-directs or tells you exactly. I would like, and again, I thought my understanding was it's going to tell you now you need to call and make a report, or now you need to do this. I think that if we have something, if, you know, once you get to this decision of what it is, that it immediately directs you in the direction, because again, you know, not to say our time is, we're all running to the next task. So let me put it that way. I did want to say, probably not the right time to say it, but I sat in a pre-class this weekend for mental health professionals. And one of the things that we talked about was the reporting hotline. And we talked about how, you know, we're a mandatory reporter, but the questions on the hotline, even at the state level, are asking us to make decisions that aren't in our scope, meaning they're at the end of the call, they're asking us to make decisions about how would you rank the child's safety right now? What do you believe the next step should be? And it's like, you're the investigator, I'm just a reporter. So I said for this class, I said I would take that up at my next meeting, and that was my due diligence on that one. So, but I did like the Connecticut model. I think that we could do a lot with that, and it puts a lot of the questions out of the hands of the consumer or the reporter. It's leading us into what our answers are based on how we answer the questions. So that's my 2 cents.
Thank you, Chris. Michelle?
I think it would be important from my lens to have the ability just to make it easy and a platform both on the computer but also on a cell phone. So making sure that it is usable on in both forums. I think as quick as it can be, but as comprehensive as it can be, which I know is difficult, but really helping parcel out the different types of maltreatment, and then maybe having, you know, being able to step it down very quickly with, okay, you're concerned about neglect, and then walking through the different types of neglect, or you're concerned about sexual abuse, and then helping them get to the decision of, does it need to be reported or not. I think it would be important to have some sort of verification for them that they worked through the tool, so that if someone were to come back later and question their decision making, that they could say, I walked through the tool and the tool did not you know, indicate that I needed to make a report. So some sort of proof for them. I hear a lot from reporting parties just wanting to have proof. I also think it could be helpful, although we have a statewide hotline, if folks could enter an address of where the child resides to know what county the child belongs to, I think would be helpful, especially, I mean, I know, I'm sure it happens across all 64 counties, but for those of us in the metro area, you can cross the street and literally one side of the street is Adams County, one side of the street is Arapahoe. So the easiest way that they could enter the address, know what county the child resides in, and then be connected to or have the phone number for that county in addition to the statewide hotline, because I don't think most folks know that when you call the statewide hotline, once you identify the address, they'll pop you into that county, unless that you have a contract with that. The state has a contract with that county to take their calls. So I just think ease, comprehensiveness, dual platforms would be probably the easiest thing that or the quickest things that we should be thinking about in terms of a tool like this. I really did like evidence changes process. I thought it was quick and easy and fun, not fun, but fun, but it was great to navigate from my perspective. It was just, it made me very excited about the ease of it. So.
Awesome. Thank you, Michelle. Lots of good nuggets there. Margaret?
So first of all, yes to everything that Michelle just said. I completely agree. I want to point out just briefly, because I don't want to repeat, I think one of the things that's tricky here is that we need to give people really clear language and simple language, not necessarily legal language, which is, I think, kind of replete in the New York model. I think evident change has simpler language. I think it has a softer approach to implicit bias, which I also think is really key to include. So I'll stop there.
What do you mean by a softer approach?
I feel like, yeah, it felt more baked into the process in the evident change model. And New York had, like a separate page where you could go and you could click into the Harvard test, which is super interesting. In fact, I was playing with it again this week because I just like playing with my own ideas.
The different kinds.
Yeah.
Yeah.
I did the presidential one this week, which was kind of fun. But yeah, most people aren't like that. I think most people are just going to do their business, go in and get back out. I don't think they're going to read that second page. I don't think they're going to click into a different document. And evident change had it right there in front of you, and it wasn't optional. So that was something that I thought felt softer.
Awesome. Thank you, Margaret. Jessica?
Yeah, I loved the evident change. I've actually played with it a number of times now with kind of different scenarios to kind of see what the output would be. I loved all the resources that it had, where it would ask a question and then be like, if yes, here's some examples of kind of typically how that would fit in, or if no. And I loved the links that they had to resources for where it would just immediately pop up, examples of healthy sexual development depending on the age versus problematic sexual behaviors. And I just thought, especially with all of what we've spent a lot of time talking about, right, with some of the myths of sexual assault and physical abuse that tend to make mandatory reporting decisions really tough, that provided a lot of immediate resources. I also do prefer, and I had asked a question about it with evident change, but I prefer those options where it's not necessarily another human who's listening to the facts and making opinions on it. To me, that is a potential, another layer where then we have to say, well, how are those folks trained? And are they trained appropriately? And how are they with bias? And I also think it's scary to kind of shift that over into, again, one of our big concerns with this task force is, where does the liability exist for mandatory reporters? Does it exist for that reporter? Does it exist for their institution? Does it exist for the person that they told? And they've asked them to report. And suddenly I think liability gets a lot more squishy when we have another party answering questions and the reporter going, well, they told me I didn't have to report. And a lawyer down the road like me goes, well, they were wrong. And that's on you. And I'm sorry. So I get really nervous about that being just putting more potential for human error in there than we already have, and more potential for bias. I did really like also well, and my other caveat though with evident change is I have no idea how much that costs. It seems like a really beautiful project that they hand tailored to every state. And I thought that was awesome, but I'm very curious about the costs because it seems like it could be expensive. The other, I really liked the New York State website. And I do want to shout out to that. I think that CPO and our agencies here already have really amazing websites. We haven't really dug into them, I think, specifically as part of our research here. And maybe that's because it's assumed most people in this group have used those websites. But honestly, I was looking through it for the first time like a week ago before our presentation and found really great resources that we have. So I don't want to discount those, but I did really like New York's setup for their website because you could click on, you know, a certain area. This morning I was playing around with the domestic violence prevention, and suddenly you get to a page where you not only have kind of input on what to report and when to report, but also you can click immediately and very easily like drag you over to service providers to connect you with the right advocates in the right, and it's location based. So when we're talking about those warm lines for those who might not need reporting, but we want to connect with services, it really goes not only by topic area, but then also by location. And I'm forgetting it now. A couple of weeks ago, I was looking at one of the sites where I'm pretty sure you could kind of look at a map or plug in a location, like what we were just talking about, that I found would be really helpful. So to me, trying to minimize human error is important. The ease of accessing a website is important. And I think that, you know, if we have the option for phone calls and kind of warm lines, that we just want to be very careful about whether they're advising to report or whether they're actually a warm line to services when reporting's not already been determined to not be necessary. To me, that's the safest kind of amalgamation of those services that would help mandatory reporters do their job.
Awesome, thank you. And I love you and Chris both just reminded me of the interconnectedness of these approaches. So, you know, as we shift from this conversation to, you know, Jordan and Brian working on draft recommendations, you know, we're talking about each of these individual approaches separately, but they're not all necessarily really discrete. Like you could have a warm line and a decision support tree or decision support tool. So the interconnectedness of these three approaches, I think, is also something that we want to tease out in this conversation. And I appreciate you and Chris both doing that in your share out. Roshane and then Ida.
Thanks. Yeah, I wanted to, so I'm hoping that this won't matter, because as we move on to like who is a mandatory reporter, I hope our recommendation is that DV advocates get removed and it doesn't matter. But I do want to notice that like confidentiality remains important, and some of what we're talking about feels really exciting, because something like the decision tool might be an option for a confidential advocate to be able to get support and help without it being documented anywhere. Right now, when you call, it says you're calling anonymously, but it actually records that call, which means there are ways that people could eventually get that information. So I just want to keep confidentiality in mind as we're talking about this, whether it's like there's good pieces of this on both sides. If we can give people a tool that doesn't record any personal identifying information, doesn't record the name of the advocate, things like that. And if not, then I want to make sure we're keeping that in mind as we build the tool that we are building that confidentiality in. So just naming those two things.
Awesome, I appreciate that, Roshane. I mean, those are important details, right? As you consider both the models that have already, been presented as potential options, but also as you think about customizing to Colorado, really being intentional and considering existing pain points and wanting to include some of the provisions that perhaps these other states and approaches didn't consider. Ida?
I really appreciated the just-in-time nature of the decision-making tool through evident change. When we're going to be talking about training, I know in upcoming meetings, But it also presents an opportunity to gather data around this decision point from mandatory reporters so that we can continuously improve the changes that we're making with this task force recommendations. And so I think it's complementary, not just the other, like the warm line, for example, but also complementary of training because of that data provision. So I feel strongly about collecting the data if there is any kind of decision tree that we're enacting.
Awesome, thank you. And I don't think I mentioned this in previous task force meetings, but my great grandmother's name was Ida. So every time I see your name, it like makes my heart smile. So I just
I
thought
love
I'd add
that.
that. Yeah.
I love that. I'm named
Gina.
after my grandma too.
Oh, nice. Gina?
Yeah, thanks. I had to go back to my notes. I feel like this was many conversations ago for me, so
Every day
I took
feels like
notes.
that's with you, Gina.
Wild. I'm like, did I say that to you guys? I don't know. So kind of something that I wanted to lift up was, and these are jots, so let me put it together for you while I'm reading it back. Trusted adults versus peers in the child sexual abuse reports in the tool. Just wanting to, lift that up, that what we played with, it kind of didn't distinguish, and maybe there should be in terms of that, where it comes to those pieces. And then
Hold on one second, Gina. Did you play with that with the New York or the evident change tool?
The evident change.
Okay, thank you.
We liked the New York one, but with the evident change one, that was kind of the one that kind of fell out for us. And then trying to work through how that reporting process goes, like between children and law enforcement. I'll try to pull out some more what I meant by that. And then going through the hotline, limitations on age and how teens are abused by people in a position of trust. Just wanted to lift that out. But like we're not looking for like a carve out, but like teens, with teens, but with like some around teens and not cooperating with law enforcement investigations, where this is about a trusted adult or caregiver, kind of regardless of age, just wanting to lift up the ambiguity that exists around young folks that are teens versus smaller children. Just kind of where we can make sure that we fit in those considerations, kind of similar to that confidential piece. Let's see. And just wanting to emphasize trying to move, and I think we had tried in our discussions to move from the neglect piece and strengthen the abuse algorithm in this tool. So that's kind of what I wanted to make sure to mention here.
Awesome, thank you. So really wanting to include more guidance, less ambiguity around sexual abuse, specifically as it relates to different age groups, particularly adolescents. Okay, thank you. And then Sam?
Something I think that was important in the Arapahoe document was talking to the family, but I think that being part of the process, like, did you talk to the family? Did you ask them? But like, if nothing else, just to keep it front of mind that that's what you should be doing, is actually engaging with the family. So I appreciated them saying not only should you be talking to the family, but asking them what they want. So I thought that was important to make sure that's built in to the conversation, that you're doing that step. Because we talked a lot about that throughout this whole process of just really keeping families involved and keeping that relationship strong by doing that. I really appreciated there being a combo line. I think it helps people feel comfortable calling. If I know that this isn't just like a abuse report or a warm line, I appreciated that coming together because I think people would feel more comfortable calling. The two other things I wrote was just, I appreciate having a decision tree like the New York one. I would love it if that was a little bit longer and there was a little bit more examples of like, what does a no look like? What does a yes look like, to help people walk through that? Last thing I'll say is I think it's really important that those documents are available in a print form, just being mindful not everybody has the same access to internet, and whether your internet can really go through that tool well. I know one of the roles I'm supposed to be here is like in a church setting. And so I would love it if I'm doing a training and I'm giving you this 2-3 page document so you can really see it and engage with it without having to necessarily go through the whole tool, but something that you can quickly reference to say, okay, here's where the yes is or here's where the no is. And back to what a couple of people have mentioned is that document for records. So I can have that 3 pages or whatever, write the client's name on it, and then put that somewhere to have some documentation, or to go over that with a supervisor if you are in a setting that allows you that capacity, so you can dialogue with another person of, this is why I said yes, or this is why I said no.
Awesome. Thank you, Sam. I love the inclusion or the addition to the conversation around accessibility of the tool, and having a mechanism for individuals who may not have access to technology, who have a preference for paper, or who have other processes in place, or want to keep the documentation, to be able to review the tool, fill it out by hand if they needed to before actually going into a rubric. So I really like the addition of that to the conversation. Appreciate it. And it's good to see you, Sam. I know that you've missed the meeting, so it's really good to see your face and hear your voice. Any other ideas generated around must-haves for Colorado to implement a decision support tool for mandated reporters? Ashley.
I also liked this idea. I think I'm not a mandated reporter, but just listening over the last year to reporters, it seemed like there was a lot of just unsureness about when to report, when not to report, and worry about liability. And I feel like this kind of tree would instill some confidence and make people feel a little bit better about making those decisions. And I also see that the tree helps kind of find the off-ramp, because it sounded like a lot of times we're reporting even though we're not sure it's actually child welfare because the family needs supports or whatever. And just when I walked through that New York one, it seemed really easy to differentiate and be like, no, this isn't a call to child welfare. This is definitely something else. And you feel more confident about that. So I feel like we'd get more families in that off-ramp. The part that I thought was missing, though, is that when it says like, no, you do not need to make a call, but if you have concerns about the family, you may choose to refer for services or supports, you need another arrow that then says, here's some options. And I think that would be really important, so that all in one document, you can do all the pieces. You can not only get in the off-ramp, but find the help. Because otherwise I worry that they might still call just because they don't know what those other services or supports might be. So I think that would be a good piece to like ensure that off-ramp happens.
Yeah, thank you. Yeah, okay, so reporting to the child abuse and neglect hotline is not appropriate, but what, right? Yeah, I think that's helpful. And then I just want to name or lift up Ida's comment in the chat, connecting this conversation with the last decision point that this task force had around the conflation of poverty versus neglect, and trying to exempt from reporting, from mandatory reporting, poverty related issues. So reinforcing those definitions that distinguish poverty from neglect. So I appreciate you naming that, Ida. Dawn?
Thank you. I just also want to call out that it would solve the problem that we have in the childcare industry, where the institution is saying you must report everything. You can't determine what abuse and neglect is. So it would give them a tool to go through that process and have something to show that they did that. but keep them out of that other part of the system, which would alleviate a lot of the calls that you receive, I believe.
Awesome. Thank you, Dawn. So really reinforcing in a meaningful way the shift from just report everything, child welfare will figure it out, to like really trying to empower potential reporters and mandated reporters included to, you know, make critical decisions around whether reporting is appropriate under the circumstance. Awesome. Thank you. Kathy?
So I think a decision tool and all the things I agree with everything we've been talking about. I think one of the things that I'm just sitting with is this sort of tension between so the comments about involving the family and what does the family want, I think is really important. Is I think with my healthcare provider hat on and maybe even I'm not an educator, but thinking about educator circumstances, I think sometimes it's hard to know what to say to the family or how to talk to the family about the concerns, especially if it's really around sort of sexual abuse, physical abuse, as opposed to neglect. And I think there's a fear of asking too much or engaging too much and possibly messing up a investigation. I think this was talked about with some of the tools. So I think something that helps guide the reporter in what they can and can't do or should and shouldn't do in terms of what questions are asked, what information is gathered. I'm a huge proponent as a healthcare provider of letting families know, like, engaging with them. But I also know there are some circumstances, particularly in the education setting, where that is complicated, right, in terms of safety and immediate decisions. So I think something that gives some guidance, because I worry a lot of times I hear from healthcare providers is I'm not supposed to ask anything. And that's not true either, right? Like, I think we want them to find out some things when they make the report. So I think just guidance in that area would be very helpful.
Awesome. Thank you, Kathy. A great point. Like a tool does not provide the level of training development around what does engagement look like, what might a conversation look like to engage with a family. I think particularly in the circumstance where more information might be needed, or an alternative path might be warranted based on the particular circumstances. I want to quickly move us to a couple of other questions if we can get to them, but really to start to surface what might be, as you think about potential implementation in Colorado of some hybridized version of what we've seen already. Love that you provided some must-haves in whatever tool might be developed for Colorado. But what are some of the challenges and barriers that you anticipate encountering in rolling out a tool? And then, as you name any of those, what are some of the ways that we could recommend to mitigate any of those challenges or barriers? Adriana.
So I support all the suggestions that were made. A big piece that I really loved kind of about all of these is that there is a trained individual, because yes, mandatory reporters are fabulous, but we're never going to train them to be child welfare experts. We don't want to. That's not their role. And so my concern would be finding money, finding individuals that could run whatever program we decide upon. We, especially, I'm in Delta County, we have a critical shortage of social workers out here available. And so I would just be concerned, what does that look like? How do we recruit those individuals? That's kind of my concern, regardless, whatever that looks like or whatever we decide to implement.
Awesome. Thank you, Adriana. Ashley?
I think one of the biggest barriers we're going to have, and it's not going to be unique to this particular recommendation, is how you actually get this in the hands of all mandated reporters, because there's like gajillions and there's not necessarily a central agency for each group. And so how do you make sure that all the people that are required to do this get the tool, understand how to do it, and have the training? Because I think that's one of our big issues, is that training is sort of hodgepodge. Like if you're a teacher, you get training through, school districts. And if you're a soccer coach, you get training through maybe your recreational department. I mean, it's just so hit or miss. And so we really, I think, would need to be strategic about how to do that. And maybe when you're first standing it up, there's some sort of like time limited group that's doing it, and then it goes from there. I don't know the answer, but I think that's going to be a big barrier to a lot of the work for us.
Awesome, thank you. And training is one of the specific areas that we'll focus on in our recommendations. Any other anticipated challenges and how to solve them, Sam?
I think one of the things we've talked about in various ways is just the bias about a call, that people really believe making a call is the best choice from a safety perspective, whatever. So I think one of the big things is helping people understand that making a call has negative outcomes. It doesn't always have these positive outcomes, and really making that something that's not just like, oh, just think twice, but because there's been such strong campaigning about making calls, I think there needs to be really strong campaigning about why not to make calls. So
Yeah.
I think that that's important, just people's own bias of what it provides. The other thing I think, having been a foster parent, is people think they know what's developmentally appropriate behaviors. I was this, I was that. So really encouraging people to recognize this tool is actually telling you what is developmentally appropriate at this time in this way, because there's so much misconceptions about developmentally appropriate and about what actually is inappropriate sexual behavior, I would say, between two children or even a child a little bit older. I think we focus too much on chronological age and we don't help people understand developmental age. So that's something I think is important for people to learn about, specifically in that sexual piece. And the last thing I'll say is DEI bias should be something we're doing before we're making reports, not trying to figure out our bias in the middle of reporting. And so I think that needs to be a really integral part. I went to a training in Minnesota. So I'm trained in something that's called the Intercultural Development Inventory, and it's about how you approach different cultures. And that was a requirement for all their child welfare staff. And so thinking about the ways that DEI is built in from a pre-service way rather than a how do I check my own bias in the moment, I think is really important.
Awesome, thank you, Sam. We're going to take Roshan and Michelle and then Gina, and then we'll transition on to the consultation approach. Roshan?
Yeah, this might be a little bit DV specific, but I don't think so. I think the other thing we want to prepare folks for is if we're moving people more to resourcing than to just reporting and hanging up, noting that it's not always a satisfying outcome when you call. Like so the example I have in DV is people often call and say, I need shelter for this person. There's not a shelter bed. And then they're like, I guess there's nothing we can do. And then they hang up, and then they don't and then they don't engage in other ways. Or the assumption is they've tried and there's nothing else. There's often a lot of problems with that approach, but just to name that, like, the resources are stretched all over the state. People aren't going to immediately get a call, like you're going to maybe get a call that's not as satisfying. It takes a long time. They don't answer the phone immediately. It takes a little while to get the answer you want or to get through. So just, I think helping, I don't know exactly what that looks like, if it's training, but somewhere in there preparing people, because I think a lot of times what happens is in the eagerness and the hurry and the busyness of the reporters need, they just want to hand them off to somebody else, often with good intentions. Like, I don't know how to do this. I want this person to take it. But if, we have to make sure that handoff is good, I don't know. Does that make sense? That they're, like, it's not just like just that first call may not be exactly the right answer. Like, you want to prep people, or there's somebody else helping to make those calls that does have that training. But
yeah, I think as we have the conversation about warm lines, I think that point is going to be especially resonant in the whole point of that is that the needs of the family are not about child maltreatment or substantial risk. It's about the family needing services and supports, and there has to then be available services and supports, or a response that is helpful to the reporter. And right now there are challenges to that. Thank you for naming that, Michelle, and then Gina.
When I think about concerns, I will tell you, reporting parties by far complain most frequently about the amount of time it takes to make a report in Colorado's system. That, and Chris mentioned, we use an enhanced screening guide that comes with dozens and dozens of questions that a lot of times reporting parties do not understand that we're required to ask, like asking them to scale. So I think my biggest concern would be is if we say do the tool first and then go sit on a hotline, especially in a metro county when it already takes 20, 30 minutes to make a report. They're sitting on hold 10, 15 minutes. Now you want them to back up and start a tool first. So I think we have to talk about the whole continuum of from the time you do the tool to the time you make the call. There has to be some narrowing. And especially for our super busy sort of frontline first responder type reporting parties, so law enforcement, emergency room doctors, things like that. I've listened to a lot of calls and people get frustrated with our system. I can't imagine what it would be like for them to then say, we want you to do a tool first. So I don't have all the answers for you yet, Doris, about how that would look, but I think we have to think about the continuum and figure out how to narrow it as much as possible to be effective, because I think we'll lose people if we say do the tool, then call if we want you to call.
Yeah, thank you. I think that's a fantastic point. Gina?
Yeah, I want to also name a bit of reality in terms of what obstacles there might be. So there's already existing in our smaller communities. I can speak for my own, I'm going to say a bias towards DEI, towards sex education. I mean, right up to a sheriff said that if he saw any type of brochures, posters, any kind of publication, propaganda, he called it, where in any school setting or where children would be that spoke to sex education or consent, keeping children safe, that he would remove them himself. And so in our smaller communities, a lot of this mindset is protected because of all the things, right? And so my concern is, and I just want to name that, is that all of these pieces are so important, and I agree that that needs to happen. But we have our communities that exist in Colorado where that's going to continue to be an uphill battle. My answer to that is if this is formally put into law, and I hate forcing that hand because we should want to collaborate. I'm just speaking on a realistic level that a lot of this is going to have to be by force in terms of making this kind of shift and asking people to buy in this way. And this is again speaking to like trying to change hearts and minds, right? And biases. Like I don't know what that'll actually be, but I want us to be like, front thinking in terms of that, because that's going to be a very real situation. And, at least from my experience, and we're still trying to get that prevention piece out there, but it exists.
Yeah. Thank you. Thank you for naming that. I mean, sort of getting people to adopt new practices, particularly that are explicitly include equity related considerations. I think it's worth noting where there may be some barriers in, both understanding or agreement with those approaches. I said that Gina, you were going to be the last to speak before we transitioned over. Jane, you're usually fairly brief. I'm going to let you wrap us up and then transition it to Trace.
No one ever says I'm brief. Okay. I just a couple of thoughts too, as we think about this, because this just kind of popped in my mind, and maybe somebody's already kind of talked about it, but the way the statute's currently written with either law enforcement or DHS, I mean, our focus has been mostly about like DHS reports, right? But what I'm concerned about is, what's the law enforcement piece here? If someone's out in the community and they're watching something happen, I'm thinking about a personal circumstance I had at Walmart years ago, where I had to call the police, not social services, because there was an incident happening right in front of me. And the law enforcement officers didn't feel like there was enough to really charge the parent. But as a mandatory reporter, I was still required to make a report. And all I had was a license plate number. And so there's these nuances here that I'm thinking about, where do we, where do we draw lines between, or make it easier for mandatory reporters to understand as we look at the statute and how that current language is written in with making these reports. And if we're talking about tools and we're talking about limiting human contact in the equation, I worry that, you know, we need to really think holistically through, you know, all kinds of different scenarios that we do experience daily. Thank you.
Thank you, Zane. Passing the baton to you, Trace.
All right, thanks y'all for that. I'm going to pivot us into this discussion around consultations. So obviously clearly connected on the same kind of mission here around what problem are we trying to solve with this topic, really around aiding mandatory reporters and choosing whether a case meets the threshold requiring a report. And it's going to look a little different coming in and partnering with folks and supporting them in a specific way. So the biggest energy was around the Arapahoe County example. So Michelle, I might kind of just call on you to kind of dig in with us as far as when we get to the elements piece of, you know, what might you highlight as working or replicable that people aren't highlighting. But want to just throw it to you all first. And when we think about this question around what are the must-haves for a consultation approach to be adopted in Colorado, the only thing I'll say is let's pause on like the challenge. Let's make sure we're not talking about the challenges yet. Let's talk about, you know, let's assume that implementation and those sorts of things can be spoken about in the challenge piece. But right now, like, what are the must-haves for a consultation approach to be adopted in Colorado? And I'll open it up for folks. All right, Michelle, maybe I'll pick, or go ahead, Zane.
I have a question. I was just gonna say, I think to a certain extent, maybe it's already occurring, but very informally. And so maybe people have some examples of, because I know my agency gets calls from time to time from mandatory reporters, or I'm a CASA organization, and they may have some specific questions. They're not ready to make a report yet, but they may have some questions. And so, you know, I'm always trying to answer those. So I think I've been kind of in that role just informally. I'm just curious what other agencies have experienced, because I'm wondering if there's already something kind of happening.
Margaret's saying same. Margaret, what does that look like from your perspective? How do you see that kind of in the informal space?
So it happens both, obviously in trainings, and just to remind folks, I work for the Office of School Safety. So a big hunk of our training work is training mandatory reporters to identify child abuse and report it in accordance with the law. And so we get those those questions in the trainings, and they're often real case study situations. They aren't hypotheticals. Because I've had, as the former child sexual abuse prevention specialist, I was kind of the face of that work for 8 years in the office. So I get those calls pretty frequently just on the day-to-day. People will reach out and say, don't know what to do here. I'm concerned. And I can often give them an idea of what should go just straight to the hotline, what they should be thinking about should go to law enforcement or their local child welfare office, or what I consider to be kind of those both cases, and let them know what I've been told from child welfare about what's going to be screened out automatically, how they can bolster a case. I give them the consultation framework that the Red Team operates off of, and kind of talk through with them, okay, you're not bothered because this kid has lice. Tell me more about what's happening, and kind of help them think through why it is that they're worried about the safety of the child. And usually it's not that presenting factor. So anyway, that's just kind of what it looks like from my desk. I do a lot of that counseling with them. And unfortunately, my default, or fortunately, but my default is usually, if you are in doubt, you absolutely need to make the call because you know the family, you know the baselines, you're reading things that I can't know from my kind of cold perspective.
Thanks, Margaret. And I think I see Kevin and Kathy with their hands up too. I think I'm hearing the theme of like, this does happen informally. And so I want to make sure that we're also recognizing, you know, who is it happening informally with? Who's comfortable enough to feel like that's a system that they're comfortable with calling, right, informally to ask those things versus someone feeling like, intimidated to make that call, that sort of thing. So that would be where this recommendation might lean in as far as clarifying that this is an opportunity for people to get that consultation versus and maybe going against someone's perception that if they call, someone's going to say, well, now you have to make a report, or who is this, or that sort of thing. So I think there could be some interesting clarification there. And I'm interested, Michelle, to hear from you in a minute around, you know, since you've kind of formalized this in Arapahoe County, like what is the difference you see in the informal versus formal, and how has that really shifted people's perception of like this is a tool for them? So I just think that can help us shape up a specific recommendation in a way that takes all these good things about the informal piece and makes it more of an opportunity and something that's baked in. So Kevin, I'll invite you in, and then Kathy will come to you.
Thanks. I wanted to get just a little bit of clarification around whether we're talking about installing some sort of consultation within the mandatory reporting system or within the organization or agency where people are working. In my place, I'm the consultation person, and one of the things that comes up for me regularly is this idea that we operate from, which is already a 24-hour turnaround time on making decisions and taking steps. And just looking forward at that 24-hour deadline, there may be some organizations or agencies that don't necessarily have the capacity to have somebody available right away to talk through everything. And I can tell you that on the night of significant event of my life, I was on the phone trying to sort through some of these issues. And it can be demanding on organizations and agencies to meet that deadline.
Yeah, and Kevin, I think the first part of your question around the where is something that folks were wrestling with. Where would something like this live? Is something that I saw folks wrestling with in the survey responses too. I saw, you know, one person say, I'd love to see this live in a non-DHS agency. And obviously, Michelle, I'd be curious to hear from your perspective, you know, either whether you've seen this entity as obviously it's been a pro and people like it, but do you see that being a possibility, and how would that interact with the system itself? So I think I want to raise that as something that people raised in the survey responses of like, could we explore that? So I think, Kevin, it's a great question. I think that's something that we need to answer. And I think that I'm going to put that on the shelf a little bit for the barrier side of like, that, you know, what would be the barrier in it being non-DHS, or what would be the barrier in it being DHS? So let's come back to that particular piece, but Kathy, jump in, and then Brian, I'll bring you in too.
Yeah, so in speaking about this question about informally this happening, I mean, as a child abuse pediatrician, it's not an uncommon thing that, especially from healthcare providers, we may get a call and say this, you know, it's actually very common when we're on call to get calls to say, does this meet a requirement? And it puts us in a, you know, to be frankly honest, I think it's a really challenging position because at the end of the day, we don't want to be in a position of of saying that you can or you should or should not report, because if something happens and there's a perception that we suggested against reporting, then there's a liability on both that individual and honestly, potentially us. And this has become really challenging, right? So we try to be a source of information. But Michelle, Dossie, I remember the days when healthcare providers could easily call and ask questions like, does this meet this requirement? You know, is there been involvement with this? You know, whatever those questions are. And then that sort of stopped. And it really created, from a healthcare provider mandated reporter sense, it created a lot of anxiety. Like, I don't know if this meets that level. And so they were looking for other places. And it often came then to us, and it puts, like I said, it puts us in an awkward spot because I don't feel that we should always be, now, if it's a question of, is this injury consistent with an accident or not, that is what we do. But if it's a question of, does this really meet a mandate to report, that feels like it's something that we shouldn't be in a position of making suggestions around, and having that sitting within DHS is super helpful, because that fear of liability, if I do or don't report, at least, kind of wearing that healthcare provider hat, that's been my experience, that would be super helpful to have, have that back. And so what you're doing in Arapahoe, I think, is met with some relief, although I don't think a lot of people know about it.
Yeah,
I'm
so
on
you
mute.
get-
Sorry, Brian, one real quick. I'll come to you in just a second. I think the one thing I would say, Kathy, there is that I want to come back to that when we get to the problem kind of solving piece, and make sure that, I'm seeing some head nods yes and some head nods no. So curious to hear some other people's perspectives on Kathy's thoughts around the DHS kind of challenge there and what that looks like for organizations that are non-DHS. So I think it would be really good to kind of dive into that a little bit. So want to respond to that and want to bring other folks in, but I want to make sure we get to this key elements piece. But Brian, go ahead, jump in, and then we'll go to Stephanie.
Yeah, thank you. I think we're basically saying the same thing. I was going to say that hearing the concerns about it being located in location X is useful, but also, Jordan and I are going to be drafting these recommendations based on the conversations that we have today. So if you have suggestions on where it would look good, please voice that, and we can take that into consideration, so that, like, just Kevin had mentioned the like, whether within the institutions themselves or within more of a centralized state provided system, whether that's DHS or not, just please, give us your recommendations on where that would look good, because both positives and negatives are very helpful. But in order for Jordan and us to write, this will be housed blank, it'll be useful to know now what you guys think is the best solution.
Yeah, and I'm putting it on the shelf though, Brian, for that particular piece, because I want to get to the essential elements of the tool itself. So I want to make sure we bring that back in, because I think that's the barriers. I'm just anticipating some people seeing that differently. So I think that we need to talk about that on the barrier side. But Stephanie, go ahead, jump in, and then we'll keep going.
Yeah, thanks, Trace. I think when I envision a consult, I really did envision it being staffed by child welfare or public health people, right? Folks with experience. I didn't see it as a requirement for the 40 mandated reporter organizations to have somebody with some sort of specialty. I also just being responsive to Michelle's comment, which I really appreciated, about extending the time in which our mandated reporters would then have to be with a tool and a consult line and a hotline potentially. Do you start to segment out some of our mandated reporters, right? So in other words, I am like Kathy, I understand the days, we used to call DHS for consults, and, are there a top 10 reporters, if you will, I don't know, where you start to prioritize who's calling. So medical physicians, I think, would be, should have direct access immediately via phone call, right? I think emergency responders potentially. And so I just wonder if we could also get creative with the list of mandated reporters. I mean, film processors, I don't even know a film processor anymore, but maybe they exist, right? I mean, is that a person that, do we need to keep flooding human services is my point, or public health agencies? And would we be wise to separate and slice and dice out based on data, who those frequent callers are, what the constraints are, and try to prioritize, I guess, at some level, what services we provide for what reporters. It's just a thought.
Thanks, Stephanie. I'm gonna go to Jade and then Roshan.
Thanks, Trace. I definitely agree with that, Stephanie. I think that's a really interesting idea. Also, what Kathy put in the chat around segmenting out by concern, I think, is also really interesting. But what's kind of coming up for me is that I think these all three of the things we're discussing today, warm lines, consultation, and decision support tools, are going to look different if it's just one of the three that moves forward versus if it's all three that move forward. Because I think if the decision support moves forward and then consultation is just the piece that happens like in those gray area cases, that feels a lot different than if we aren't moving forward with a decision support tool. Or if there isn't a warm line, we could send families too. So there's, and Doris, you said this earlier, but how these all hang together, I think, is really coming up for me. The other thing I wanted to name is, we have really similar experiences to what Kathy mentioned and to what Margaret mentioned around getting those phone calls and trying to figure out where is it appropriate for to provide guidance or not. And I actually think the informal nature of it right now is what feels really dangerous, because it does feel like it's just kind of off the cuff. It's dangerous for those of us that are providing the guidance. It feels like it could put those that are asking for the guidance in a bad spot. It also, to Jessica Dotter's point earlier, raises the human error component, because you're not talking about not that we aren't all trained, but depending on who's calling who for guidance, it's not necessarily consistent answers depending on who you call or when you call them. And so I do think there's just a lot of risk in the current informal setting.
And Jade, I'll just say, and Doris, I'll bring you in just a second. The one response I was just thinking is, as far as the question around if all three move forward versus one versus two, we are moving all three forward as recommendations. So I think I just want to clarify that it's important for us to consider that. And that might be something we could kind of weave into these conversations of like, okay, knowing that these three things are moving forward, how do they play together? Because I'm thinking of like, yeah, how does a decision tool play into the piece of the consultation, right? That the consultation actually is utilizing the decision tool, right? Like those sorts of things. So just want to clarify that that these three things, because of the survey and because of how we move this forward, they will be moving forward as recommendations. So it's good to work from that assumption. Doris,
yeah, and if I could just add, I think just because we recommend all three doesn't mean that all three will get implemented. So there might be space for putting some in our recommendation, some caveats around if only, or I don't know, something that enables us to have some protection there.
Yeah, and that comment actually, Jade, I think relates to the question that I was going to ask a follow-up for you, is that recognizing that the recommendations would include all three of these approaches, are there specific conditions that would need in your mind to be included from the warm lines and or the decision support tool that would make you more okay with the consultation? So like what elements would have to be true from the other two approaches in order for the consultation model to be effective, in your opinion?
I love that question. So I love the consultation model in general. I think it makes me nervous the way that it's currently informal, because I think that's where you end up with lots of different people with lots of different opinions. I think it is a little bit, if decision support and consultation, then this is when you call one, this is when you call the other. If only decision support, what is it that we're missing in our community, which we talked about in the last conversation, which is that gray area. Okay, now what do I do? If only consultation, how do we do that in a way that the person giving the consultation has the resources to do so consistently, such as maybe their own decision support tool on the back end, but that might be differently able to be resourced than building a decision support tool that the whole state has access to, for example. If only a warm line, that's great for families. What do we do for mandatory reporters? And so I'm more thinking just that, I know that when the recommendations leave here, they're going to go through lots and lots of rounds of legislature and all the things. And so are there some caveats or more details or clarification we want to build in that almost says, if these three things don't all move forward, here is what you need to have in mind, because here's where the gaps or the holes might be.
Awesome, thank you.
Yeah, and Jade, I appreciate you raising the clarification of what you're saying of like, I thought you were asking if they're moving out of us, but yes, if they then move on. So I think there's certainly some language that we can work on that kind of talks about these things as a package, and it's like working together and how they support one another. So Roshan, and then I have a question for Michelle. I want to bring you in.
I guess I feel like maybe we're moving in a direction that feels a little different than what I was thinking we were talking about, which is I think what I've heard us talk about for the last several months is that part of the problem for mandated reporters is we're all in our own boxes in some way, and part of what we need to do, part of the consult that we need is somebody who might see it in a bigger way, right? Somebody who will call us into, hey, did you think about this bias? Hey, do you know? And having been a mandated reporter in a lot of different spaces, like as clergy, as a therapist, as an advocate, like in all of those places, you have a specific window, you have specific training, even in the best of situations, even if we take everybody, even if we say everybody is perfectly trained and has great intentions, which we know is not true, but say it is, you still only have your window. And so I would want the consult to actually be bigger, and maybe not be specialists in all of that. Like that's what we do as specialists, like we get referred into specialty, but the consult is more of an umbrella that says, hey, okay, I hear that you're worried about this thing. Let's back up a little and look at the whole picture. And then that helps the family, that helps us think about how to actually help and support this family, as opposed to like, I have to do my job only, which is narrow. I would also say working at this as a statewide trainer, I want to lift up the fear around it. Or repeat what a couple of people have said about, I mean, there's a lot of informal consult that goes on, and it's really dangerous, I think, because people get very different information. They get very different ideas. They may or may not be talking to somebody who has more training than them, or, you don't know what they're getting. And I think, and right now, like we work with folks where I'm like, in your county, call CPS and do an anonymous report and ask for help. I think your CPS is great, they'll do that. Other counties, I don't think that's true. And it's really dangerous to have this kind of like I think the mismatch across the state is what's dangerous, because I don't know how to direct a specific advocate to make a choice, because I don't know who they're going to call. I don't know who they're going to get on the phone when they do call. So having like a smaller, better trained, net that can do that umbrella work and then send people into the specialties feels like a better choice to me. Thinking about it from what we're trying to work across so many disciplines. Let's make sure that the consult does that.
Yeah, and Roshan, I just want to say that I think that's exactly where we're like what you're recommending here is what we're trying to get at, which is what are the elements that would make this that would reach the solution that we're looking for, which is a more consistent response, which is a more trained, all the things that we've named the last few months. So I appreciate it. I think people are making comments around some of the different challenges, which is why I was kind of like, let's put those on the barrier side and let's get to like the what, right? So I think you put us back on track of like, what is this what, which is this like more specific umbrella that takes us out of our like, unique windows that we're in, and really is a well-trained, consistent resource, so that if I'm in La Junta calling for a consultation and I'm in Adams County calling for a consultation, I'm getting, consistent consultation. That's kind of what I'm hearing from you. So, Brian, go ahead, and then I really want to get to Michelle with a question.
Yeah, this is a component of evident change, so technically in the decision tool, but I think there's crossover into this consultation area, where one element of what evident change talked about that was interesting to me was talking about in the state of New Hampshire system they were setting up, the Attorney General coming out with a memo saying that if you take the decision tool, if you go through the evident change decision tool, you have like a printout stating that you did it that was time-stamped, that as a mandatory reporter, that's fulfilling your legal obligation. So for the question of liability, one component we could attempt to bake into, whether it's the decision tool or the consultation, is some way of saying like, well, I've spoken to this centralized whatever and gotten the consultation for yes or no, and being able to have sort of like a receipt about that, I think could be an interesting way to ensure that this actually is successful in decreasing the amount of calls. Just so I know a couple of people have brought up the question of legal liability, and I think that just that one example from New Hampshire is one kind of flavor of what that could look like, of making sure that not only would we be propping up and recommending the decision tool or the consultation, but actually having it like hold legal water could be a reassurance for mandated reporters.
Yeah, curious what folks think about. Well, let me come back to that. Michelle, I want to bring you in to this question of like, we're looking at, again, almost 70% of the folks that filled out the survey were like, yes, what Arapahoe County is doing is great. Let's look at scaling that. Curious from your perspective, as you look at what is baked into your program there as the consultation piece, what are the key elements there that you feel like are replicable at scale in the way that we're talking about? What would you, I'm just thinking programmatically and like the unique challenges that you have seen, and knowing kind of like what Roshan's saying around like what we're saying is the goal here, like what elements from your perspective, and let's come back again to the where this lives, but really just thinking of the program specific and the policy recommendation we're making. What is it? What are we getting at?
Yeah, here's what I'm gonna try to sum up for you, just based on what I'm hearing from you all. It's more than just consultation. It's also coaching and education. So educating about what the child welfare system does and doesn't do. It's about engaging with them, teaching them how to go back and engage the family, how to ask them questions, how to elicit information, how to understand what they need versus making assumptions about what they need. So it's more than just do you report or do you not. We get a lot of do you report or do you not. The majority of questions I get are around sex abuse, primarily around statutory rape, and the statutes around statutory rape. And is it legal or is it not legal? I think we can't forget the conversation that somebody said just a little bit earlier about it's not just about child welfare, because a lot of stuff is third party, which is law enforcement only. And I don't make decisions based on what's a crime and what's not a crime, because that's not my pocket of expertise. I can certainly cite to you statutes in Title 18, but I think we have to hold that piece as well about if it's a crime or not a crime versus is it child abuse and neglect in this, by child welfare statute. I get a lot of questions about neglect. Obviously, that's something we've talked a lot about. I also get a lot of questions about past incidents of reports and has it been reported and do I still need to report? Do I have additional information? Do I not? And domestic violence. I get a lot of questions about domestic violence and what is a child protection issue and what is not. So just for context, that's what the bulk of calls I get are about, or that we get are about. I think I shared with you in the last meeting that we were evaluated by Kemp, who made a recommendation to us that we consider housing this service outside of the Department of Human Services, that there is bias on behalf of the department in the decisions that we make, and that do people feel comfortable to call the system? Are we going to, unintentionally absorb them into our system when they're calling for preventative level services? So it's something that I've thought a lot about. And I understand. I mean, I personally hold a lot of child welfare expertise and feel comfortable to consult and can leverage what I know about the system and being a part of the system as a part of that consultation and education and coaching. But I also recognize that I hold bias. I hold bias in every decision that I make, because I too don't want to see children abused or neglected. I don't want to be on the front page of the newspaper. I don't want to hold people's liability. And there is liability in any decision or any consultation that we give as a department. The other thing I would tell you, Trace, is that if you were to take all 65 of my management staff and give them the same scenario, we're going to give you different answers. One of the things that I battle in the system is the challenge of my own supervisors and administrators and managers in making consistent decisions and understanding the complexities of the law. Child welfare law is not easy to understand, and it is sometimes vague, and that's good, and sometimes it's vague and that's bad. And so people struggle to understand, like, what is child abuse and neglect? And so our ability to clean up the law to make it as clear and concise as possible for mandated reporters is the same for making it the same internally. And so my fear around sort of spreading this as a concept and having child welfare make the decision is that in my own department, people are not going to make the same decision, and everybody comes with their own implicit bias. So I think that's a challenge that I worry about. And then the last piece that I will share with you is that I have the ability to look at what's already in the child welfare database, the system trails, to leverage that information with what folks are consulting with me about. If you house this concept outside of child welfare, they may or may not, depending on how the law is structured or the program is structured, have access to see what is already there. And what I've often said in mandatory reporting trainings is that, let's say Kathy calls me with a specific she's one piece of the puzzle, and I can put her in the whole picture of where her piece goes based on what I can see in Colorado and Denver courts and the trail system, right? To help then say, you are the missing piece of the puzzle, and your one piece of information helps us make the bigger picture decision. So if you're thinking about this as an outside entity offering this service, would they have access to that information? And I'm sure some of you on this call would say, I'm leveraging information that maybe I shouldn't be leveraging, right? That we don't want to weaponize system information against families. And so I'm trying to be very conscientious about that and ensuring that we don't do that. But I have to be honest that sometimes people call me with information that I'm like, aha, you have the missing piece of the puzzle. We had all these other concerns that we couldn't really make heads or tails of, but now you've provided this information that sort of gives us that bigger picture that says either we don't need to report or we don't need to respond, or we do need to respond. So those are sort of the things that I feel like we battle every day in this sort of concept of this program.
Yeah, Michelle, I really appreciate you just naming like what you're wrestling with there, because that's exactly what I was like, oh man, people are going to be like, you can't bring up, and build a case against people. So I appreciate you naming that is the challenge. And you've also seen where that's a benefit too, and like getting all the information that you need to make really tough, decisions. So I want to kind of open that piece up, and we're kind of limited on time here. So what I want to think about is this specific question of the where. So, I want to move into that as like you kind of heard from Michelle around the pros and cons and the challenges. And Kathy, you kind of mentioned, this could be helpful, but also Michelle said, in their audit, it was also recommended that it be moved outside of DHS because of those pieces. So I want to just kind of hear from a few more folks around where you see the pros and cons there. And what you really are kind of coalescing around. So Sam, go ahead and jump in and try to keep us in the lane of the where piece if you can. And let's kind of hold space for that for a bit before we move on.
Yeah, I think to what Michelle was saying, and I hope that this connects because to me it does, is just people's ongoing history with the system. So I've said before, one of my roles here is someone with lived experience. And so my birth mom had 8 CPS calls over 20 years. And so she lost her last child based on previous drug use, even though she wasn't currently using at that time. And if we would have based her situation solely on that child, the outcome would have been very different. And so I think that when people who have negative experiences with counties then aren't going to call counties. So I think that we have to be honest that things being tied to government systems inherently makes people not want to call. I think the flip side of that is having a central way that people know, like 211, county numbers. Those are things that people just know to go to for resources. So I do think there's that other piece of actually disseminating that this is where you go for resources. As a layperson, we've been talking a lot about mandatory reporters, but there are people who call that aren't mandatory reporters. And I want to make sure that those people also know who to call and why to call. I think the other thing I would say is there's just the bias of feelings versus facts. So I feel this way because of whatever versus the facts of a situation. And I feel like that's the goal of consultation, is to pull out the facts and remove it from the feelings. And I think that certain people, no shade, when you've been in a system for 20 years, you don't always see some of the bias and negativity in your system. And so I just want to be mindful, sometimes pulling things out of a system and into an agency allows people who are regularly working with families rather than regularly making consultations, and it changes how you think about families.
Thanks, Sam, for that. Let's do one more. Roshane, I'm going to pick on you just because I appreciated your comment in the chat if you could give a little bit of voice to that, and then I do need to move us on. So I think we're gonna have to wrestle with kind of what clearly there's just some push-pull on both of the as far as the where goes. And so I think we're gonna have to put our heads together and think about, I would be kind of curious to hear around some creative solutions around how might, let's say if it's housed outside of the department, for instance, you know, what would the connection to the department be? If you feel like the whole picture, for instance, that you referenced, Michelle, is supportive in a way, and then also, you know, conversely, like if it was housed within the system, how does it actually, you know, how is it shared with folks, and how do they know like what this is, and is there like a creative solution on the almost like the marketing side of like how we get the word out around what this is? So I don't know. I'm just thinking of like, I think that's where this is going to land, because there's no perfect, I'm not hearing any perfect kind of like moving forward on that piece. So I think it might be a creative idea from this group of how those two could work together. So Roshan, jump in, then Jade, and then I'm going to move us to warm lines with Doris.
Yeah, I think Sam already kind of made the point I was trying to make, which is like, you know, I think it's a good example actually of like when we're in our system, right? We're like, oh, this fills my full picture, but actually the picture's bigger than any one of our systems. So that was really just my point, and that also could be really dangerous. I would offer it might sit in, if we wanted state office, it could move to CDPHE, maybe under prevention services. So that we aren't talking, you know, to get back to that idea of like, it's not just a child abuse and neglect hotline, it's like a resource. It's like you know, how are we thinking about, you know, preventing on, you know, I don't know, just an idea.
Yeah, a preventative piece. And does that kind of, yeah, make sense elsewhere? Appreciate that. Jade, go ahead, and then we'll move on.
Two quick comments. One, CDEC, Early Childhood, also has a child abuse prevention unit, or in a family strengthening unit, and they have the child abuse prevention task force. So that could be an interesting connection as well. I wanted to also just kind of raise one maybe example of a way that this consultation I think could be really interesting, which is prenatal substance exposure. So we changed the law a handful of years ago around when you're required to report prenatal substance exposure, because the idea is if pregnant person is, for example, on methadone in treatment, baby could still test positive at birth, but the caregiver, the hospital person may not actually have any concerns about the safety of this child because, you know, pregnant person was on a prescribed thing through treatment. And so there's nothing actually to report because there's not a current concern. So what the law says today is impacted by prenatal substance exposure plus health and well-being of the child is threatened. And so this is an example of where we are really asking mandatory reporters to do that critical thinking to decide whether or not they have both an impact to the child and a concern about the threat to their health and well-being. What we are hearing in implementation is that that's terrifying for mandatory reporters, that they don't know how to make that determination when they just see a family for a short period of time. And so something like consultation in that really specific setting could be a really interesting way to think through or test how some of this would work when we're looking at really some more specific cases, because I think we're still seeing it come up a lot where there's, you know, the desire in the law or in the system to change, but how that actually looks in practice is really hard.
Thanks, Jade. I'm seeing some stuff in the chat that's helpful too. And I think, Brian, I appreciate you kind of bringing up the Wisconsin piece as an example of, you know, on the like kind of civic education side of like how this could be really brought into the system, current existing systems as a question, right? Like, do you want consultation? And that's kind of the way that people are aware of the service beyond it more broadly. And Kathy, appreciate your question too. I'm going to pause us here. Clearly we have some, I think it's a really great discussion. Appreciate folks kind of pushing on one another around kind of how you're thinking about this and the flags that you see. And we'll get together and see what makes most sense around what we feel like there's some, and then we'll see where we get. And I think that, again, it's super helpful for you all to respond to us via surveys and whatnot to kind of help say yay or nay, and just to see where we can get some consensus around. So that's just how we're gonna have to move that forward. So Doris, we're putting you in a pinch here on time, which I think we can be creative in the next meeting too, to kind of wrap this conversation if we need to. So just gonna name that. But let's move on to warm lines, and I'll hand it over to you.
Awesome, thank you. Trace, can we take us to 11 or 7, 10, 9, 8, whatever, no, 9. I'm trying to do the translation from Eastern to
9:40 right now.
Thank you. Can we take us to 55, or do we have to stop at 50?
Yeah,
We
I
get
think
10
we're
minutes?
good at 55. I'll just make sure that if there's members of the public on the call that want to provide public comment, please send me a note right now in the chat. So unless I hear something, Doris, I'll let you know via chat.
Awesome. Y'all saw me struggling with my mental math. My apologies for that. So wanted to bring us back to the conversation around warm lines. As I noted earlier, like it came up in bits in our earlier conversation. So you're obviously sort of threading the needle through each of these interventions and sort of thinking about them in concert with one another, not standalone. As a reminder, warm lines are intended to serve as an alternative approach when child maltreatment is not alleged, and a different pathway might be appropriate for the child and family circumstance. And so warm lines offer a way of connecting families to that needed service and support outside of the child welfare system. So I want to just open the floor with what are the critical or key components that would be needed in Colorado for a warm line to be successful and or appropriate? Michelle.
Me again. I worry that families, if we say, you know, you didn't meet the threshold of abuse or neglect, so we're referring you to this warm line, that people will get hung up on a report was made, who made the report, and that they'll be more concerned and worried about that and less likely to engage. So I just wonder, I think we have to think about that transition of being passed over. Even in our preventative work, families are like, wait a minute, a referral was made about me. What did they say? What, you know, and they go into the defense mode, or they don't want to engage with us. They don't want anything to do with us. They're afraid to be vulnerable, speak with us. And so I think we have to think about that, right? And how to best engage families in that way so that they feel supported. I wonder about maybe some sort of a marketing campaign to help them understand, like, we don't want you in the child welfare system. We want to help you. These are folks who sit outside the child welfare system. You can feel free to be vulnerable and courageous and ask for what you need, and we will help you, so that there doesn't feel like there's that consequence.
Awesome, thank you. And I think the thing that is coming up for me too about some of the earlier conversation is, you know, the training piece. And if a mandated reporter or person in the community is seeking to access a warm line to connect a family, they probably shouldn't lead with, we made a report to the hotline and that wasn't accepted, and so we're going this alternative pathway. So that education piece, I think, is important for those who make reports as well as those who might be receiving services. Margaret, and then Jade.
One of the things that concerns me about this concept is sustainability of the concept. And I would want to be sure that we had an appropriate fiscal note to keep a warm line going so that people aren't just handed a list of resources in their community that may have become obsolete. They need an understanding of what the resources are that are available, what they provide, what the differences are, who can help now, who can help later. There's just so many nuances. And I just want to be sure that people don't conflate a warm line with this concept of here, go figure this out for yourself. Here's some paperwork. See ya later. Good luck.
Awesome, thank you. So that infrastructure and the sustainability planning are really critical components of this. Jade?
Yeah, I was going to say clarity on who the warm line is for and when it is recommended. So is the warm line for mandatory reporters? Is the warm line for families? Is it both? And so like when does that fit in the picture? And then also something around to your other part of the question, are there existing warm lines? How does this fit with the Colorado Crisis Line? How does this fit with 211? How does this fit with the other things that we know are being promoted across our state as warm lines or hotlines? And are they being accessed? Are folks using those? Are warm lines still how people will ask for help, or is there a different way we want to think about some of that?
Yeah, so follow-up question, Jade. Is there in your mind a recommended path forward in terms of who would access the warm lines? Would that be for mandated reporters or professionals, or would that instead or in addition to be available to community members and or families?
I think there's a lot of different options. I think, the New York model that had lived experience families answering the phone and really connecting with families that were seeking resources, like that was a really cool model. I think we're seeing those pop out around the nation. I'm curious about utilization of those because I don't know how families are calling and asking for help, and I don't know how that connects with like what's in the chat, what 211 already does that is just more of a resource and referral line. I think we're starting to blur a little into like actual program implementation, because we're starting to then talk about navigators and how do those navigators work with families and how long do they work with families, and that gets kind of out of this warm line concept of just like I'm calling and asking for help. I think that part of the consultation could be the warm line for mandatory reporters. So again, if we're moving forward with kind of a few different pathways, if I'm a mandatory reporter and I call for consultation and it's not report, then it's, well, here are the resources, here's what you pursue. It's not sending the mandatory reporter now to another warm line. It's like we kind of blend these together, but we'd have to be really clear on the audiences for each.
Thank you. Michelle, do you still have your hand up or is it up again? Okay, that's up again. I saw the O. No worries, no apologies needed. So there is a question in the chat from Yolanda around whether we are talking about a separate standalone warm line or we're talking about 211. I think that's the question for all of you as we think about what currently exists in Colorado. And as you think about this approach, whether you could build off an existing approach like 211 and adapt that approach to also incorporate warm lines, or if your recommendation would be to stand up a separate line that's specifically for this purpose. I think that would be the question for this group in terms of where are you leaning, and if you have a position, why? Sam?
I like what Jade said. I think that to me, there's two warm lines. One is built within 211 because that's where families are often referred to, regardless of where they live. So that being more for the everyday person, so to speak. But then when I'm calling to make an actual report, that's kind of my warm line for mandatory reporters. That's how it goes in my head of just trying to teach people a new thing versus really utilizing the systems that are already there.
Thank you, Sam. And I think just want to note what some folks have shared in the chat that currently 211 provides resource lists and not connections for families with particular resources. And so just want to name that and that if the task force, goes with a recommendation of leveraging 211 in expanded kinds of ways, really thinking about how to ensure that families ultimately get access to what they need through that vehicle, if that's the recommendation. And then Brian put in the chat something that I don't want to read. So Brian, can you come off mute and just share out? Kathy, you can
Yeah,
laugh
sure.
at me.
Yeah, just to say that, so in that resource that was sent out, we talked about, there were 3 examples in the narrative, but then on the final 2 pages, there was a chart that compared 9 different Careline program or Warmline programs. And almost all of them built on currently existing structures like 211s or local nonprofit services. And that was definitely something that New York talked about, was like spending a lot of work before their HERES program got set up, networking and working with those existing structures already. In San Diego, it's literally called the San Diego 211 line, but they build in links into the system. So for instance, when abuse and neglect reports are screened out, referral to 211 San Diego is one of the options given to the hotline workers. So there are just other ways. The question is how to embed it and when to embed it into what mandatory reporters in particular see. But just to answer the general question of whether this could, I'll fast forward to the end. We don't need to start from scratch and ignore all of the good resources that are already out in the community. But a lot of these examples of warm lines elsewhere build on and then amplify those structures, and then being able to give it the weight of, like, state power and maybe some like legal mechanisms reifying it is what makes it such a helpful tool.
Thank you, Brian. Jade, I see that you put in the chat a link to Colorado Crisis Services as another option. You want to share, really quickly, just a little bit about that particular model?
Yeah, my understanding is that this is through the Behavioral Health Administration. It is more focused on mental health and substance use disorder support and finding access to those kind of resources for families. And I know that it's, really being heavily promoted. And so again, I think it's just a question of, there might be a couple of different, I wonder if as a task force, we might not feel like we're ready to say, attach it to 211 or attach it to this or attach it to that. But maybe our recommendation is, do an inventory of existing warm lines or support lines in Colorado, and then make some strategic decisions around how to place this with that.
Awesome, thank you. And then also just flagging Brian's note in, some programs implementing navigators and other mechanisms to provide not just a warm handoff or connection with the person to get linked up with services, but also some follow-up. Dawn, and then we're going to have you, Stephanie, then wrap us up.
I do think it'd be great to do a recommendation that some funds be set to whoever operates that warm line, so that they could do some specific marketing to property owners, right? People who will be making rental spaces available and that sort of thing. I think housing is like the toughest piece to fill right now. And so if you can have landlords increase their awareness that, I can actually tell them, and they'll get the word out about what I have available for housing, then that would be a great support for whoever runs the warm line, so that they can not just give you lists upon lists.
Awesome, thank you. Like really thinking about a particular need that you have in the community, that you see in the community, and trying to incorporate that into the resources that are available. Stephanie?
Yeah, I just wanted to follow up on what Jade said. I think task force are tricky, right? I've seen recommendations where it's like, we should have warm lines. Everyone's like, that's fantastic, right? Whatever, right? Like that recommendation goes nowhere, right? Or would you have, but yet you have to be high enough level to the point that we are not developing the program itself as a task force, right? We'd need 3 to 5 years for that. So I'm just wondering if as we explore these services, do you make a recommendation for a consultant, somebody who's a third party who, to Jade's point, does the inventory, comes back with recommendations on how the state could use existing resources to plug in these various concepts that we like and apparently approve, at least according to our polling. So I throw that out there to the group, right? I think the struggle is always finding that mid-level recommendation. And I offer that just to Jordan and Brian as well. because this is years of work. I mean, that's the truth of it, right? We spent, 30 years, many of us in this system longer, some of us 40, right? And so it's going to take a bit to unwind. And so with that in mind, I just suggest or ask this group, and maybe we're out of time, but is that level of recommendation something this group is comfortable with? And so I just throw that out there.
Thank you, Stephanie. I mean, I think that we can certainly, there's no one I think that signed up yet to give public comment. So I feel like we could do just a very unsexy, unsophisticated poll and use the raised hand feature just to get a sense from folks if, it would be helpful, similar to the prior recommendations, to have, not make a recommendation that's really a level of specificity on what Colorado should implement, but to have an opportunity to do that, that analysis and inventory to bring in a third party to do that. If you like that approach, if you could use your raise hand icon just to denote that so that Jordan and Brian have a little bit of input. Roseanne, I saw you come off mute for a clarifying
Can you just
question.
say it again, Doris? I just want to make sure I know what you're asking. Sorry.
What you're voting on. The approach is to basically recommend bringing in a third party to do some of the legwork of analysis of what exists today, and what might be go into a specific recommendation, including the inventory or items that you lifted up in our conversation today. So delegating some of the research before you arrive at a specific intervention, delegating that research to a third party. I saw some hands go up and then down. So just making sure right now, if your hand is not up, then you are not in favor of that approach. Right, so it looks like it's maybe half of you. All right, thank you. And then Crystal, were you raising your hand for public comment? Okay, I'm gonna pass it over to Trace.
Oh. Were you calling on me?
I was clarifying, but since you came off mute and started talking, we'll just open it up for public comment. As a reminder, we're not going to provide a response. Your public comment will go on the public record, and others, if you could let Trace know that you wanted to provide a public comment, please do so. Thank you. Go ahead, Crystal.
Yeah, thank you so much. I just wanted to say, I really like that you guys can't just make a recommendation for a specific thing, but your conversation today has been rich. It's been the best conversation from the task force that I think I've heard during your months. And I heard a lot of key elements that people stated were going to contribute to a successful system. So I think you have a lot of the research that you're talking about without making a specific recommendation, and you might still need this next step, but all of those elements that people talked about, you listed a lot. The other thing that I just wanted to share is that Larimer County has kind of a consult warm system right now called Supported Families Stronger Community. And they hired some folks with lived experience to be those navigators that consult. And it's kind of under the DHS, but it's not really. So there's kind of a little hybrid thing there, but it's being evaluated. Soon it's going to have a formal evaluation published, as well as a cost benefit. Somebody talked about cost at one point. So anyway, it does serve as kind of a combination warm line consult. Of course, not every county can afford to hire folks, and I know you're also considering something on the more regional or statewide level. So just wanted to share that. You'll have actual data within the year.
Thank you, Crystal. Trace, passing it off to you.
Yeah, thanks, Crystal. Always appreciate you being here and your comments and support for the task force. We are right at time, so I'm going to end us. If you can believe it, we're back next week. And so clearly we have some momentum here to build on. So I actually think it's well timed and appreciate folks committing to be here. This helps us move things along. So we'll change a couple things around how we revisit a couple of these things to tie some things up, but I think that we'll do a lot of writing between now and then as well. So appreciate folks. Stephanie, any comments from you? Okay. All right. Well, I'll wrap us right at 10 o'clock. Appreciate you all. Have a great day. We'll see you next week.